Okay, we still have a couple more people joining, so I'm just going to give it another minute and then we will start our presentation. All right, I think that the registration has kind of slowed down, people coming in, so we're just going to get started. Hi, everyone, and thank you for attending Invia Fertility's webinar on maintaining emotional wellness during your fertility journey. My name is Vicki, and I'll be your moderator for this informational session. I'm honored to present to you the panelists of our webinar, Dr. Mary Speno and Dr. Klipstein. Tonight, they're going to do a conversational session discussing emotional wellness in regards to infertility and treatment. Dr. Klipstein trained at the University of Chicago for medical school and then completed her residency and fellowship in reproductive medicine at Harvard University. Invia Fertility Specialist has 3 physicians in total, Dr. Pushek, Dr. Karandi, and Dr. Klipstein. All 3 of these physicians are board certified in the specialty of obstetrics and gynecology and a subspecialty of reproductive endocrinology and infertility. We also have 4 locations for the convenience of our patients. Our main office is Hoffman Estates. This is where our surgical suite and embryology lab are located. We have satellite offices in Arlington Heights, Crystal Lake, and Northbrook. Dr. Mary Speno earned her PhD in clinical psychology from the University of Missouri, St. Louis, and completed her clinical training at Rush Presbyterian St. Luke's Medical Center in Chicago. Fun fact, Dr. Speno has been working with Invia Fertility, providing psychological consultation and services since 2006. She is an invaluable resource to Invia and to our patients. If you have any questions, please type them in the Q&A section, and we will have time at the end for a question and answer segment. Now I'd like to turn this over to our presenters to teach us about emotional well-being during fertility treatment.
Hi there, Dr. Klipstein. It's my pleasure to be here with everybody today. We, from the beginning of Invia Fertility, have always put a lot of importance on the emotional well-being of our patients, and we have just such a wonderful resource in Dr. Speno, who, as Vicki had said, we've been working with for well over a decade, and it's been a wonderful relationship, and she's been really wonderful in helping our patients navigate the emotional minefield of going through fertility treatment. It's not easy for many people, and I feel like taking care of your emotional health oftentimes gives you the strength to move forward and be able to continue with the fertility treatment. It's really a vital part of what we do. So let me introduce Dr. Speno, and she will make some introductory remarks, and then we'll ask her a series of questions and benefit from her expertise and her wisdom. Dr. Speno.
Thank you. Thank you very much. Well, I'd just like to echo what Dr. Klipstein said, that yes, indeed, maintaining your emotional wellness, your balance is a major challenge when you're undergoing fertility treatment. You know, our research has shown that the level of stress, the intensity of it is equivalent to someone who has a cancer diagnosis and is fighting for their life. So that's quite intense. You know, further research specifically on women pursuing fertility treatment also shows that they have much higher levels of depression and anxiety than women, comparable women just in the population at large. So while infertility is not terminal, it just feels that way sometimes. And why is that? That's because you have suffered a loss. You know, you have suffered the loss of not being able to have that genetic connection to your child, or not being able to carry that child. It is a big loss. But even beyond that, encapsulated by that, is the loss of a dream, of not being able to have a baby the way you wanted. It's not part of what you imagined your life plan to be. And that is a real loss. So I am basically here to validate your feelings, to tell you that we know that this is a very difficult thing that you are facing down and engaging in. And we just want to help you be able to manage it as best you can.
So I thought what we would do is start with different topics and aspects of the fertility journey that may be challenging. And the first one is this question of grieving. So how do I cope with the emotions I'm having when I realize that I won't be able to have a baby in the way I'd initially intended? That's sort of my fantasy of what it would be like to conceive is not the reality that I'm now faced with. What do I do? How do I handle that?
Well, the very first thing that you have to acknowledge is what I just said, is that this is a legitimate loss. And you have to acknowledge this to yourself. Your partner has to acknowledge it. And even if people around you don't acknowledge it, I can't tell you how many times I've heard the story of a woman, say, having a miscarriage, and you know, people saying to her, "Oh, well, you can try again," or "Don't worry, it's going to happen for you," or you know, like it was, you know, fluff it off. Where this is actually the parents are already bonded to a child even as early as 6 weeks. This is a legitimate loss. And the only way to resolve grief is to go right at it. You cannot circumvent it and resolve grief. You have to deal with it. So, you know, for the sake of clarity, I'd like to remind you of the 5 stages of grief, knowing that not everyone goes through every stage, and not everyone goes 1, 2, 3, 4, 5. There are 5 stages. You might know this already. But to talk with you about how this might look as you're trying to grieve the loss of not being able to have a baby the way you want. So, you know, the 5 stages are, first, of course, denial. So this might take the form of, you might say to yourself, there's a mistake here. Do that test over again. I don't believe it, or right away go for a second opinion somewhere else and just flee and start over like it didn't happen. So you're in a state of denial. And but the denial does not produce the desired result, right? You're not getting any closer to what you want by staying in denial. When denial starts to fail and it doesn't really protect you against the feelings of loss that you're avoiding by denying, it leads to anger. Okay, that's the second stage. Anger, you know, women in anger, we don't talk about that very much. You know, that's been a big topic forever, ever since I've been a psychologist, is women in anger, and lots have been written about it. Mostly they don't talk about their anger, but it can come out in all sorts of ways. You know, I'm mad at the world. Why me? It's so unfair. All those kinds of thoughts. You know, even a 19-year-old can have a baby. Why can't I? If she's drug addicted, this, that, or whatever. But me, I've done everything right. Why is this happening to me? I have sat with people, with women for years now who have had that and need to express that anger because it is unfair. So they might strike out at their spouse or even the professional and say, you know, you're not getting my desired results here. I'm going somewhere else. Who knows? But anger is there. But then, of course, it's obvious that that's not getting you any closer to your goal either. So then the next stage is bargaining. Okay, and this is the stage where you say, okay, I'll do anything it takes to have a baby. I'll do anything to have my baby. I'll stand on my head 6 hours a day, every day to have my baby. Oh, I promise to God I'll be the best person ever. Well, it's obvious that you can't keep that up, or that's not going to work or get you any closer to your goals. And by that time, you've expended a lot of energy and you drop into the fourth stage, which is depression. You may have thoughts of, you know, I'm never going to have a baby, so what's the point to all of this? I just can't go on. It's never going to happen for me. I don't have the energy for this, and so forth. These feelings of depression. And this is the stage where you're most vulnerable to fleeing treatment. I can't do this anymore. This is too upsetting. It's too stressful. I don't have a life. I'm not going to get what I want, etc. But if you begin to face down your feelings of sadness and loss, eventually you can get to the stage of acceptance. And basically what this is this has happened to me, but I'm going to be okay. You reclaim your life again. You're not besieged by anger or going into denial again or pursuing drinking 8 glasses of pomegranate juice a day, or you're not doing any of that stuff anymore. You're finally saying, okay, I can't make it happen, so I have to figure out something else. And when you finally arrive at resolving your grief and get to the stage of acceptance, you're ready, you move into an action phase. And when you get into an action phase, when you feel like, okay, there is something I can do, what that leads you to is a sense of hope inside. Like maybe it's not going to be the way I want. I have to give up that dream. That dream is gone to me, but maybe I can have another dream. Maybe I can make it happen another way. So finally, acceptance leads to daring to hope again.
Yeah, thanks, Mary. It's so interesting because I often sit across the table or across the Zoom meeting, I guess these days, with patients of mine, and they can't see the other side, right? And having done this a long time, I can say, like, look, you're likely to get pregnant. This is going to be okay. But I feel like sometimes it's hard for my patients to hear that because they just are in this place where maybe the denial or the anger. And so I think that's really helpful. So what strategies do you use when someone comes to you and, you know, the doctor is much more optimistic sometimes than the patient. And so how do you navigate that to help patients get the strength that they need in order to go back and do the things they do? Because ultimately, I think part of the struggle is to find the emotional energy to do treatment until you get pregnant or until you find other ways to have a family. And so, and you don't want to stop before you get there because you don't have the kind of emotional charge to do it. So I guess the question is kind of how do you help people find that energy to move ahead?
Right. Well, people come to me at all different stages. They can be in any one of the stages of grief, or they can have already resolved the grief. Many of the couples that I see, and we'll be talking about this later in the recipient couple appointment, you know, they've already gotten there and they're ready, they're on the verge of being ready to take that step. But over the years, you've, you know, sent me many patients that are in that phase. They might be stuck, you know, they can in their grieving process. And, you know, that's part of what psychotherapy does, is it helps the person to be with their feelings so they can actually feel the sadness, so they can actually do the grieving, instead of trying to avoid it. All of these stages that I've just described are all ways to avoid feeling the loss. And part of the therapeutic process is helping people to understand that they can feel that loss and they can survive it. There's another side to it. And that's what psychotherapy is. Sounds simple, help them to face down their feelings, but it can sometimes be a very difficult thing to do. So then for those who finally get, and some people get stuck and they do have to come for therapy. Not every client does, though. They're able to navigate these stages and get to the place of acceptance. And when they finally get to the action stage, they become more animated. They get that energy that they need, that you're referring to engage in treatment. They begin to partner with their doctor in the treatment team. They ask lots of questions. They do tons of research. Hopefully they're going to reputable websites, ones attached to universities and research centers, and reading good books that you've recommended to them, and not so much immersing themselves in blogs. And I know you're all tempted to do that. I do recommend against that, just because not that the pain, that you can't resonate to that person's pain, but their particular case may not bear any resemblance at all to your situation. And it could, generally people only feel worse by going on blogs. So I'll talk a little bit more about how to decrease your feelings of isolation in a little bit, but getting energized to do the research. I'm almost always, when I'm interviewing the woman in the recipient couple appointment, they describe to me all the research that they did and how it helped them to eventually be able to embrace a different option than having a baby the way they thought they were going to have it. So now, there's cooperation, it's full steam ahead. And then, of course, now the real stressful point, the real stressful time sets in, okay? Because now, okay, here's your checklist of everything that you have to do. You have all of the appointments, and it's like, well, how do I get off of work for this? What do I tell them, et cetera, navigating all that. All the medications that you're taking, and we know these medications have emotional side effects, or they can, some worse for some women than others, different tests that you have to take, procedures, not to mention, navigating the financial straits of all this and the impact that it has on, your resources. Each one of these things has a particular stress that is going along with it. But you should know that these are typical stressors. They're unavoidable. It goes along with the package of fertility treatment. But that still doesn't mean that you can let them get the best of you. It's still a challenge, and it's important to really focus on how to keep your stress level as minimal as you possibly can, and not to overreact to all of these, stressors that you're having to do in order to engage in treatment. Okay.
So then I have a question. So oftentimes, and it's interesting, so oftentimes an individual or couple will reach a level of acceptance, and with themselves they're doing quite well on their day-to-day, but then there comes a time when they have to go to a baby shower, or their family and friends ask them, like, how's it going, are you pregnant yet, or a holiday comes up, or a wedding, and so these sort of external stressors are different from the internal stressors, but they still have to be dealt with. So what strategies do you have to advise patients to handle these external stressors and these questions that are often well-meaning, but sometimes very painful?
Yes. Well, you know, there's so much about engaging in fertility treatment that is beyond your control. You know, there's the uncertainty of it. There's no guarantees that it's going to work. You're really hopeful and optimistic that it's going to work, but there's no guarantees. You just feel like so much is outside of your control. But my main message to you about this particular dimension, how to deal with family and friends, I want to say to you that you can control this, okay? Try to avoid taking the position of being a victim. In other words, if I go to this, someone might ask me a question that'll be upsetting to me, and how will I handle that, and so forth. Be proactive, okay? Come from a place of mastery and control. Decide what you want from people on this. So let me tell you, in our country, we value privacy a great deal. We have a lot of laws protecting, say, our financial information and our healthcare information and so forth. It's a norm that everyone wants to have their personal information private, and that's a right that you have. So I'm empowering you to understand that it's a right, that you don't have to answer any of these questions that anybody asks you. But there is a difference between keeping something private or wanting something to be private and feeling like you have to keep a secret. Okay, a secret is something that has attached to it roots that go really deep, and at the end of the bottom of these roots is some very uncomfortable feeling like sadness or shame or depression, anger, regret, and so forth. And the secret is, if you told what it was, all these feelings would be let loose upon you. And so sometimes you even keep a secret from yourself. So, you know, my whole career has sort of been built on helping people deal with their secrets, so to speak. Facing up to that and, you know, feeling loss, okay, attached to that, you might want to keep that a secret, or because, you know, it makes you feel sad, or it makes you feel ashamed, that maybe you feel it was your fault that you can't have a baby, or you feel like you're damaged goods in some way, and so forth. So if you deal with that, when it comes time to face the world about it, you won't feel so fragile. You won't feel like you can't stand up to it. And so, again, I hearken back to this theme of face your feelings. If you need support in facing feelings, go get it, wherever that might be, to your spouse, family, friends, reading, professional, etc. Because at the root of all this is not dealing with your situation. If you deal with it and you resolve it and you're okay with it, the rest of the world either be damned or will be okay with it, you know, basically. So practically speaking, when you find yourself in those situations, because you do have the right to privacy, I suggest planning ahead, some type of response. And the basic one that I suggest to people all the time, which generally stops a person who's insensitive or, you know, asking rude questions, you know, crossing the line type questions, I suggest that you say to them, you know what, I just don't feel comfortable talking about that now. Period. Let there be that silence. I know in conversation we find silences to be uncomfortable, but you're not the one who's uncomfortable. You're not the one who crossed the line. The other person did. So let that person feel a little bit of discomfort from this, from your response, and maybe then they'll think twice about asking another person some type of question like that. So in terms of who do you tell about this? You know, who do you allow into what I call the circle of trust? You know, people that you trust. that can keep your information private, but might not quite understand everything you're going through because they've never been exposed to this before. Well, another way to be proactive is to educate them, point them in the direction of, information where they can learn about your situation. I enthusiastically recommend going to the website of resolve.org. This is a national organization that offers support for women going through fertility treatments, for having fertility problems. They have support groups, but they also have this just amazingly comprehensive website. And on this website, they have a lot of information directed specifically toward family and friends to educate themselves about what you're going through. And just point in that direction, that's a really, really good start. And at the end, I have some books that I would recommend to you that you can recommend to your family members to help sort of like get them up to speed, make them, full members of your circle of trust, and know that you can go to them for support. And then finally, if you are in a place where your emotions are like really raw, that you've just had a very big disappointment, and you're not feeling well, etc. And okay, this weekend is the baby shower that you've been invited to. It's really okay to beg off. If you really are feeling that way, and to beg off and absolutely not feel guilty about it. Okay. If the hostess, oftentimes I've heard hostesses say, but it won't be the same without you. We need you there to have fun. Well, that's what they need. What you need is to stay home and heal, heal emotionally, and, hopefully if they're a real friend, ultimately they will understand that and have compassion for you and understand that you need to do this. So anyway, I just want to give you permission to do that if you find yourself in that situation. Okay.
Thank you. That's very helpful. I want to switch gears a little bit because we have some questions about egg and sperm donation. So a number of our patients need egg or sperm donation for various reasons. Some know all along, so our same-sex female couples know that they're going to need a sperm donor. A woman maybe who was in menopause from an early age knows that she'll need an egg donor, but sometimes it comes as a complete surprise. And so, but either way, however it comes, there's this concern and the stress of not being able to have a child that's genetically related to you. And so I guess the question is, how do you help people navigate that loss of the genetic connection, which is really another way of asking, how do you handle the idea of not having the family in the way that you intended, but
Right.
specifically talking about this sort of, baby may not look like me, the baby may not act like me, and that's a little bit, I think, of a different situation and difficult in a somewhat different way, adds another layer of complexity for people going through fertility difficulties.
Right. It is a very, very thick layer of the complicated loss that they've experienced. Not only has their life plan been disrupted, it's been disrupted in this very specific way. And, what they really need, what I really try to help them to do is to understand what is it that, what does it mean to you not to be able to have a child that has your genes? What does that really mean? And it can mean many different things to many people. It doesn't mean one thing to all people. It's very individual what it means. And so through conversation, we try to elucidate what that is and then how to deal with that. There may be some irrational thinking about that. It may be that they need some education about it. If you know just a little bit about genetics, you know that, you can't order up exactly what you want when you get pregnant. Even naturally, you just have to, it's like the roll of the dice, what kind of gene combination is going to happen here. So, you know, I always say I'm blessed to have 2 children, and my son looks like my husband and my daughter looks like my sister-in-law. But I know they're my babies, you know, they were my children. So I guess I could say I truly do feel, because neither one of them look like me, like, oh, I wish they did, but there's so much else about them that about who they are that overshadows that. It makes no difference whatsoever. Once the baby gets here, if you once you have a child in your arms, once you become pregnant and you go through that pregnancy and then have a baby in your arms, all else seems to melt away. Any reservations anybody else in your life has, should you do this or not, gone. When there's a baby in your arms, the feelings of attachment are there immediately. They begin as soon as you become pregnant. We know this through research. And the attachment only grows stronger and stronger and stronger. And the need to have a genetic child melts away, and it becomes way less important. It becomes a fact, but no emotion gets attached to it. So that's how I see it evolving. That's not to minimize the pain that you feel at the moment you find out it can't be for you. Again, that's a loss that has to be dealt with, that has to be confronted and grieved, so that you can move through it, not around it, but through it, and be done with it.
Yeah, it's really, I agree. I often have patients or couples that are faced with the decision of needing to use an egg donor, or looking at other options such as adoption or child-free living. And I know from kind of taking couples and individuals through this process over many cycles of egg donation, that the decision to go through egg donation is so difficult. Picking an egg donor is so difficult. But then I see so many people coming back with their babies and so happy. And invariably, what people say is, I wish I had done this sooner. I didn't think I could be this happy. I didn't think, you don't ever forget that loss of your genetic connection. That doesn't go away.
Right.
Like you say, it becomes a smaller part. And the first time you see a heartbeat in on the ultrasound, or the first time you feel some pregnancy related symptom, and all of that sort of melts away. And so, but again, it's so hard, because I feel like I sit here and I can see the future, but but every person has to navigate that journey, and it's a difficult journey themselves. So
it's very, very personal.
Yeah, and every person deals with it in their own unique way. And so oftentimes when we discuss egg and sperm donation, we send our patients and our couples to you to talk through that. And so there are a lot of questions. I think our patients are often very concerned about what happens in that interview, in that conversation. Are you going to judge them fit or unfit parents? Are you going to make a decision of whether they should go through this process or not? Why are we sending our patients to you, and what is the benefit to them? I mean, from my point, it's very clear the many benefits, but could you speak a little bit to what happens at that appointment, and what you kind of do in order to help the individuals walk through this this new door, and this new perception, and this new reality?
Of course. Well, first of all, let me tell you what it is not. Okay, so it's not where you get a pass or fail grade. So there's no judgments attached to this. It's not a mental health assessment. Your mental health is not being evaluated, and you're going to get a report on yourself afterwards. And it's not an evaluation for whether or not you would be good parents. It's none of that. So I just want to push that out of the way. There's not going to be any digging into your psyche or anything like that. Most couples that come have never set foot in a psychologist's office, so they're not sure what to expect. And well, here I am, a psychologist, and this is sort of like in the background. You can see my books, you can see my desk. It's sort of like your study at home that you come and visit with someone. So it's not a foreign, a strange place at all. So what happens in the session is, first of all, this is a very big decision that you're making. It does mean giving up that dream of that genetic connection, and this must be grieved. Of course, we've established that already. So, but what I do to start off with is I ask you to recount your fertility journey. Okay. And the reason I do that is telling the story out loud to another person may be the first time that you really hear the story yourself. Of course, you know the story. You know you've had 3 IUIs, you've had 3 IVFs, you're on the verge of having this donor cycle, you've done this and tried that medication and whatever. You know all like the facts of the situation. But when you put it all together in a package and you put it out there to another person, it's like you're hearing it in a different way for the first time. And it's always interesting to me, the different questions that people come up with to themselves, and then we discuss them, or questions I might ask them to elaborate on more. And then they get a better, deeper understanding of what it was like for them, et cetera, et cetera. Okay, all of this is toward the idea of that they've really thought this through and that they're okay with it. They're ready to go. I mean, I do try to assess and I ask them, okay, this is really hard when you were told that you couldn't use your eggs or your sperm or you couldn't carry a child. This is really hard. How have you dealt with that? What have you been through? Tell me about that. And, that's also very therapeutic for them to talk about that out loud as well. Okay. So that is, that's a very important first thing that I do, because it kind of sets the stage. Now I know their story. Now I know where they're coming from. I kind of know where they're at. Then it's time for me to kind of get educational, okay? Because I've got a particular issue in mind that they're going to need to resolve when they have their baby. They're going to have to decide, do I tell this baby that there was a donor involved in his or her conception? Okay, but generally first, before that, it's like, do I tell family and friends? So I start with the family and friends and ask who knows about this, who doesn't, and why have you chosen these people, and so forth. And I do explain the difference between, wanting something to be private and having to have something be secret, and what the differences are. One psychologically healthy and one is born of fear of, feeling these difficult emotions, and try to get them to understand that. People come at all different points on the continuum. Some are ready to tell the world on Facebook, and others are like, no, only my husband and I are going to know forever, ever, throw away the key, those are both extremes. And I try to present information that helps them to make a considered judgment about this, okay? And this is in relation to family and friends. But I guess I would say, just as you said before, is that once a baby arrives, all bets are off. It doesn't matter what anybody thinks of it before that. If the baby's there, and that's when you decide to tell people somewhere along the line, they're not going to care, because they have their grandchild, or they have their niece or their nephew, or however the relation is. It just all kind of melts away. Anyway, let's see, where was I going with this? When it comes to the child, that's the next best step. So you don't really have to think about this, because of course you can't have a conversation with the child until, at least probably 3 or so. But I will tell you that the position of the American Psychological Association is that it is healthier for the child to be told about this. Okay, so this is, so I really, I really do share that in a very direct way, because I truly believe that is in the best interest of the child to do. So parents who say nobody's gonna ever know about it, not even the child, I do ask them to listen as I'm talking. So it's one thing to say, oh yes, you need to tell the child. But then the rest of the conversation and what I present is, well, how do you tell the child? When do you tell the child? How, you know, what kind of tools are available to help you in telling the child? I try to talk about this as a process that occurs through the life cycle, that this isn't something that is a one-time conversation where you have the child come in and sit on the sofa in the living room when they're whatever age you deem and say, we have something to tell you. No, that is not the way to do it. The way to do it is to just give age-appropriate bits of information. You form a foundation very early on, and I often say this, where I'll say, you know, your child will somewhere between, you know, 3 and 5, depending on how much, or 6, depending on how much they're exposed, you know, ask where that classic, you know, where do babies come from? Okay, so you as parents have to decide what you're going to say, but it would be very easy right at that point to say, and in your case, we needed the help of a special doctor, and her name was Dr. Klipstein. Period. That's all you have to say. But it sounds like it's very little, but you've laid the foundation for sharing the information. You will repeat this information, because I guarantee your child will ask the question over and over again. That's how they learn, by repetition. So you'll show them pictures of their story. You'll tell them their story. You know, here's mommy when a picture of your ultrasound when she was 5 months pregnant, and this is what happened on the day that you were born. We had to go here, auntie here and there and whatever, and went to the hospital, and then we came home 2 days later, and what, you know, the whole story. And you'll tell that over and over again, and you show pictures of mommy being pregnant, and that's you in her tummy and so forth. This is all their story. And this thing about the egg, which eventually, and Dr. Klipstein and the egg and so forth, eventually will find its place in that story as just a piece of the story. It's not the whole story. Right now, if you're on the verge of doing a donor cycle or thinking about surrogacy, it seems like it's the only piece. But as time goes on, it takes its proper place in the perspective of things. Okay, so that takes up a fair amount of time of the session. And then I discuss the donor selection process, at least my role in it, and what I do in terms of doing a clinical interview, a straight clinical interview. And I also use a psychological testing inventory, which is the gold standard in my profession for detecting psychopathology. And I put my findings from my discussion with the volunteer donor and their results on the test, which they have to score within the normal range. And I put a report together and I send that over to INVIA. I also will ask the couple to tell me about what it's like to go through the donor process, what their strategy is, why they decided on that strategy, and so forth. And then finally, I want to tell you that the format that I conduct these interviews is I interview one spouse and then I interview the second spouse. And the reason for this is so that each spouse feels like they have total confidentiality, that they can say anything to me that they want. I directly ask them if either of them is feeling coerced to do this. Do they have some objection to doing this, and so forth? And I get, you know, a full-throated, informed consent that they really want to do this. Now, if I discover that there is some kind of bumble on the road, that there's a big kind of like disconnect between the two of them, they're not on the same wavelength, I bring this to their attention. I bring them together at the end. I bring this to their attention. And my whole attitude toward this is, okay, this is here. What can I do to help resolve it? So that we can move forward and, hopefully to a successful outcome. So the whole thing is about helping them to understand why they made this decision, informing them and getting them to think about this important issue of disclosure, making sure everybody is on the same wavelength about moving forward, because we don't want somebody in the middle of a cycle to raise their hand and say, oh, I didn't know that, or, I didn't think it was going to be like that, or whatever, because that's a very inopportune time to do that. So we want to just make sure all those bases are covered, everybody's fully informed, and they're ready to go. And that's the whole purpose of it. It's meant to be very emotionally supportive and facilitative of the process.
Thanks, Dr. Speno. I want to leave a few minutes because I know you had put together a list of resources that are potentially very helpful for our patients. So
right.
we could maybe go through. Thanks.
Yes, let me get those. Okay. I didn't really get a chance to delve into some stress management techniques. So I'm glad we have these books that I listed here, because again, these are classics in the field for helping you to manage stress. The first one is a mindfulness-based stress reduction workbook. This was published in 2010, and it uses a mindfulness approach, which helps you to, all of these stress management techniques, the ultimate goal is to move you out of the land of what I call what ifs. What if the cycle doesn't work? What if I can't tolerate the medication? What if you're everywhere in the land of what ifs and not in the here and now. So all of these books and all of these techniques are oriented toward getting you into the present and dealing with what's here in the present, including some of those sad feelings I talked about. So mindfulness is a technique. I won't go into the details of it because I want to make sure we have time for questions, but there's the mindfulness approach. There's the stress and relaxation reduction workbook. There are several different methods of relaxation. The basic theory underlying this is that if you're in a deep state of relaxation, it's counteractive to being in a stressful state. You can't be two things at one time. So if you get good at being able to relax yourself, either through some of these relaxation techniques, mindfulness, meditation, yoga, and of course, you have to practice these things. The more you practice them, the better relaxing effect you get. The more you can keep your anxiety and stress levels down. The third book is about the concept of resilience. And this concept is about, stress is unavoidable in your life. Bad things happen to good people all the time. And what can you do to bounce back from that? How can you be a resilient person and not be pulled down by the bad things that happen to you? The fourth book is also a classic in the field, the Anxiety and Phobia Workbook. It's in its 7th edition, originally published in 1990. If you are a person that is prone toward anxiety or have been diagnosed with some anxiety problems in the past and want to have a greater understanding about the science of it and the psychology of it, as well as all the different treatment approaches. This is a self-help book, but therapists use it all the time with their clients to help people learn to manage their anxiety. And then in the next slide, these are 2 books that are specifically oriented toward learning more about infertility. First is Conquering Infertility. It's by Dr. Ali Domar. She is a psychologist a pioneer in our field. She developed the mind-body program for conquering infertility back in 1987 and has done tons and tons of research that's greatly enlightened our ability to, professionals' ability to treat people suffering from psychological distress due to the infertility journey. And then the last one is a book written by a woman and with contributions from her husband, detailing their very extensive fertility journey. This is a really good book to give family and friends who want to understand better. It might help you understand yourself better. It's written very well. It's their true story. And I think you'll find a lot to resonate to in it and very helpful information. So I recommend both of those. One is the academic approach, but also written in a very readable style that you can relate to and will resonate to you as a person who understands you. And the second is basically a self-help book. Okay, that's it.
Oh, yeah. So we wanted to go through a couple of resources, and I just wanted to make sure you had contact information. So Resolve, their website is resolve.org, and Dr. Speno just mentioned them. They're a wonderful resource. They are local, they're national, they have lots of webinars, they have lots of information on fertility, and so that's a great place to go. There are also two apps that you can download. One is actually for women specifically, and one is for Just Strong. And you can just go online on your smartphone, and they have really interesting approaches. So for example, there's like, you can dial in, I'm going to a baby shower and I'm feeling stressed, what should I do? And so there's some techniques for relaxation. There's some videos and audio information. So they're nice resources. I wanted to leave a few minutes though for questions. If you have questions, please put them in the Q&A box. There's one that just came in, Dr. Speno.
Mhm.
Is it normal to feel like you have to protect your partner from the letdown that comes with each failure? I know it just isolates me more to try to shield him, but I find myself worrying that if I don't shield him, it'll be harder for me to power through if and when he becomes very upset about yet another loss. So kind of protecting your partner from feelings of loss and lack of success.
Okay, this is a woman wanting to protect her husband, I'm gathering.
That's what it sounds like, yeah.
Yeah. Well, I think that feeling protectiveness one toward the other is natural. It's, the classic picture that I get presented all the time is, it's the husband who's trying to protect the wife. They feel so helpless at not being able to spare her, everything that she has to go through in treatment and so forth. But the key here is balance. So long as you can feel as though he is also available to help you when you need it, and there's a balance back and forth, that's good. That would be what to aim for at this point. If there's something that feels like it's out of balance, it needs to be put back into balance. And not that you shouldn't, I don't know if the word is protective, but be supportive. Not that you shouldn't be supportive when your spouse is, having a difficult reaction, so long as you get the same benefit when you need it.
Thank you. Another question. I can see the value in sharing the use of an egg or sperm donor with a child, but do you think parents should share if they used IVF to conceive their child?
I think that would be up to the individual family, and they should be aware of what using IVF means. Ask themselves the question, why wouldn't I tell? Is there a reason I shouldn't tell? And then honestly answer that. If it's because for some reason, like I said before, they need to keep it a secret, to protect the fact that I couldn't get pregnant on my own, and that feels like a failure to me. You have to decide, you have to make a decision on your own, like what are the benefits for the child to know versus protecting me from my disappointment in myself. If you deal with all of these things, it just becomes another fact. And, you know, as we know, there are more and more children being conceived by IVF now than ever. It's not so uncommon anymore. So I think it really depends on the individual and what that means to them, and if they have resolved everything that it means to them. And then they make their decision after that.
Thank you so much. And thank you, Dr. Speno, so much for joining us and giving us all of your wisdom. And I find myself calmer just listening to you and your advice. And so I know many of our patients have found that helpful as well. And it's always a pleasure to speak with you and to refer to you. And so thank you for all that you've done for Invia and really for all of our patients and helping them navigate. And so thank you very much. And thanks to the audience for all the wonderful questions and your attention.
Thank you.
And we just wanted to leave our information up here in case you needed to find us. And we will post this video on our website down the road so that you can look at it and refer to it later. Thank you so much to all of you and have a good evening.
Yes, have a good evening.
Thank you.